A silent disease, pancreatic cancer might go undetected until it reaches severe stages. On the other hand, some symptoms might possibly enhance results if they are identified early enough to warrant rapid medical intervention. In today's video, we'll go over 4 pancreatic cancer warning symptoms. Number 1. Depression or mood changes. A less evident but no less important symptom of pancreatic cancer is depression or mood swings. A lot of patients describe that their anxiety, despair, or even hopelessness struck suddenly, frequently without any obvious emotional cause or past history of mental health problems. An early warning sign of pancreatic cancer, these mood swings may show up months before any clinical signs do. Mood disorders and pancreatic cancer have a complicated and poorly understood relationship. Nonetheless, scientists think it could be caused by a mix of psychological and biological elements. According to one view, the presence of cancer in the body modifies the synthesis of certain molecules, including cytokines, which are involved in immunological responses and inflammation. Variations in mood, behavior, and general mental health can result from altered brain function caused by elevated cytokine levels. Pancreatic cancer-related hormonal abnormalities could potentially be involved. Hormones that control blood sugar levels, including glucagon and insulin, are produced by the pancreas. A disturbance in these hormones may result in physiological alterations that impact the chemistry of the brain and perhaps cause depressed symptoms. Moreover, chemicals that alter neurotransmitter function may be released by the cancer itself, which would further exacerbate mood disorders. Seeking medical assistance is crucial for those who are suffering an abrupt and inexplicable change in mood, particularly when it is accompanied by other symptoms. In this situation, depression shouldn't be written off as unconnected. Rather, it might be a crucial indicator of major underlying medical disorders, such as pancreatic cancer. Number 2. Itching of the skin. When accompanied by jaundice, skin itching, or pruritus as it is medically called, can be an early and frequently disregarded sign of pancreatic cancer. Jaundice happens when bile cannot adequately flow into the intestines due to a blockage in the bile ducts, which is frequently brought on by a pancreatic tumor. Bilirubin, a yellow pigment produced by the disintegration of red blood cells, accumulates as a result. Bilirubin is normally broken down by the liver and eliminated as bile, but when it builds up in the blood, it can settle in tissues, including the skin. The severe and incapacitating itching brought on by bilirubin accumulation is frequently characterized as a persistent, deep itch that is unresponsive to topical medications or over-the-counter antihistamines. It is crucial to identify this early symptom since it may first manifest before the outward manifestations of jaundice, such as yellowing of the skin and eyes. Although this itching is usually widespread, it can be more noticeable in some places, such as the palms of the hands and the soles of the feet. Number 3. Nausea and vomiting. Pancreatic cancer might also be indicated by digestive problems including nausea and vomiting. The tumor's interference with regular digestive functions is the cause of these symptoms. Excessive fatigue may indicate the body is exerting more effort to fight the illness. Given that the pancreas is essential for controlling blood sugar, people with pancreatic cancer may also have newly diagnosed diabetes, especially if they have never had the disease before. Number 4. Unexplained fevers. Unknown fevers and recurrent infections might be important but frequently disregarded signs of pancreatic cancer. These symptoms appear as a result of the cancer's interference with the immune system's regular operation, either directly through biological effects or indirectly through weakened immunity to infections. Usually, the body's inflammatory reaction to the tumor causes unexplained fevers. Pro-inflammatory chemicals like cytokines, which are proteins involved in immunological signaling, may be released as pancreatic cancer spreads. Even when there isn't a clear illness, this systemic inflammation can cause fever. Typical therapies like rest or antipyretic drugs may not work for intermittent, low-grade, or chronic fevers. On the other hand, cancer can impair immunity in a number of ways, which is why infections frequently happen. For starters, pancreatic cancer can change how immune cells are made, which makes it harder for the body to identify and get rid of infections. Malnutrition brought on by the disease's latter stages can also weaken the immune system. For instance, the efficacy of the immune system may be lowered by deficits in important minerals such as zinc, vitamins A and C, which are frequently seen in individuals who have had severe weight loss. Final thoughts. It's critical to see a healthcare provider right away if you or a loved one encounter any of these symptoms. The likelihood of a successful pancreatic cancer treatment increases with early identification. Please like and subscribe if this video was useful. I appreciate you viewing.